Hi, my name is Tracy Power, and I am 53 years old. I will be 54 in August. I was diagnosed with primary Addisons disease back in 2017 after battling with illnesses for probably 15 years prior to diagnosis. I would end up in another hospital, really sick. It seemed to take forever to get over any flu bug. Something that a normal person could get over within a day or two would take me 2 weeks. Um, and it was like a slow progression of symptoms. Typically, my skin was the first thing that started to show. Um, I'm usually like pasty white, and my skin had turned a really, really dark orangey brown color, and not just my creases, my whole body. Puts a photo in of right before I was diagnosed of what I look like. Um, and it's my friends from away that would be home on summer vacation to visit that would say, "Home, well, like Trace, what are you doing? Are you never were a tanner?" Because I'm an esthetician, so I never tanned, and because I knew the damages it could do to your skin. And they would be, look how dark you are. And I'm like, I know it has to be something hormonal because I'm not tanning. I'm not going to a tanning bed or anything like that. I would get so fatigued and so tired, I would have to come right home from work and go straight to bed. I went to the doctor several times complaining about it, but he would say, you own your own business, because I own a aesthetic salon and spa and an educational facility where we teach all the courses. He said, so you're working like 80 hours a week. You got two small children. So you're on the go with them all the time. And I would be like, yeah, I guess so, thinking that it was normal. As it progressively got worse, I was always a tall, thin person, but I really started to lose a lot of weight to the point that I just looked like a skeleton with skin over my bones. And I couldn't walk like 20 feet without almost having to crouch down or sit down on the floor for a couple of seconds and then get back up and try to continue on. I had gone on a cruise back in 2009, and when I got back from the cruise, I had vertigo really, really bad, and I couldn't understand why I couldn't get rid of it. But I think I was just running on adrenaline the whole time I was on the cruise, because the time change and stuff like that, and it really just shocked my body, and it was going into crisis mode. I went to a clinic to try to get down in Halifax, New Brunswick, to try to learn to retrain my brain that it was on the ground and not on the sea anymore. That didn't work. So, and the only thing that seemed to help sometimes is if I was driving in the car. Anyhow, then of course I started fainting and I started vomiting, and it would just like the nauseated all the time. Like it just felt sick to my stomach all the time. Um, I would go in the hospital for a couple weeks at a time. I would start to feel better because I would be hooked up to IVs. So I was getting my sodium, and I take away the pains in my stomach and my back. And sometimes they would give me a weekend pass to go out, and I had overheard the nurses at the nurses station on the Sunday night when I went back saying about how much pain my stomach and back was in again, and how sick I felt. And they were like, how convenient, it's Sunday night and she's back, to get her pain meds and her IV. And I remember like being so shocked and so hurt about that, because I thought, this is the last place that I want to be. I hate the hospital. So finally, my mom and my aunt Daphne were the ones that really noticed the difference in me. They could just see me slowly, they said, dying in front of their eyes. and they said, come on, we're getting in the car. If your area where I live, if they can't find out what's wrong with you, then let's go someplace else and we will sit in the emergency room until a doctor looks at you. So we ended up doing that, sat 13 hours. When I had walked into the hospital, the triage nurse had said, well, besides your blood pressure being like 90 over 57 or something like that, and high heart rate, if you want to sit out there and wait to see a doctor because of that, you're more than welcome to. And just made me feel like a bag of shit, like it was all in my head. While we were sitting out in the waiting area, I kept going to the vending machine and getting salt and vinegar chips. And I would lick all the salt off the chips and not even really eat the chip, but lick the salt, not even realizing that I was craving the salt. I just thought I really liked salt and vinegar chips. So the doctor that night, after 13 hours of sitting, finally saw me. It was after the July long weekend. I was diagnosed on July the 5th in 2017. So there was a lot of people in the ER. And I said to my mom, I think there's a lot more people in here that are sicker than I. Maybe we should go and come back another time. And she said, no, we are not leaving this hospital until you were seen by a doctor. So I stayed. Finally, when the doctor did come in to see me, he pretty much threw my chart at me and asked me if it was a effing joke. Did I not think that he had more important things to do with his acute and non-acute patients in the Moncton area, because that's where we ended up going, and why didn't I stay in Miramichi and go see a doctor there? My mom spoke up and said, listen, she's been in and out of the hospital so many times, and if you had a child and you could see your child dying in front of your eyes, would you not do or go anywhere you could to see if somebody else knows something, because we're not getting any results? So he kind of relaxed a little bit then, and I told him, I said, I work with people all the time. No, I'm not a doctor, but I do have social skills, and how you're treating me right now is very inappropriate. I wouldn't even call him doctor. I found out his name was Paul, so I would call him Paul. So he came in, they sent me down for a chest x-ray, and on the way there, I fainted, I didn't faint. I had to crouch down because I knew I was going to faint. I get into the x-ray area with the technician and I started vomiting again. I couldn't walk on the way back at all. So there was just some random guy in the hospital that got a wheelchair for me and wheelchaired me back. They did a panel of blood work. When he got my blood work back, he came in and then first thing he said to me, Tracy, has your skin always been this dark? And I said, no. I said, I actually went to my doctor and he was sending me to a dermatologist to get my skin checked because of this vitiligo. And then he proceeded to ask me if I had any hair growing in my underarm area or my pubic area. And I said, no, I lost the hair there a long time ago. It's never grown back. I was losing the hair out of my head constantly. Migraines that you wouldn't believe. And especially if I knew, for my example, my school, that my class was graduating and I was having a graduation ceremony for them, I always would get sick because I didn't realize the stress of getting everything ready and prepared, and I wanted everything to be perfect. And every year I'd end up being sick and I'd be like, what is wrong with me? I can remember many nights going to bed crying and praying and asking God to take my life, because I didn't want to take my own life. I had 2 small kids, but I'm like, if this is all I can do is just barely function, I didn't want to be alive anymore because I felt like I was such a burden on everybody around me. My husband at the time, he thought it was my diet because all I did was eat salt and vinegar chips. He thought I had got a flu bug or something from when we had gone down south that winter. And he was almost mad at my mom and my aunt Dabney for taking me to Moncton, because he thought that it was me and it was all in my head. So they did a panel blood work. Of course, my electrolytes came back. My sodium was so low, even after eating all those chips or licking all the salt and vinegar off the chips out in the waiting room for 13 hours. And my potassium was sky high. So the doctor came back in and he said, Tracy, I think you have something that's called Addisons disease. He said, so we're going to wait in the morning and we're going to do a stem test and see. So I'm not exactly sure the whole process, but they came in and they did blood work, and then they injected me with something, and then they came and did more blood work, and um, the number was supposed to go way up over 500 or 600, and my number had only gone up like 2 points. And it was like really low to like 23 or 24 or something like that. And so then they knew for sure that I did have Addison's disease, and talk about nurses and doctors apologizing and coming in, and they were like, oh my goodness, you are a really, really sick girl. The doctor I had the next morning said, I heard you had a rough night with Paul. And she said, I know he's home in bed sleeping now because I'm the doctor on call. But she said, let's give him a call, because I had told her, I said, next time you see him, can you give him a slap in the face and tell him that was an asshole to me, but at the same time, then give him a kiss and say thank you because he saved my life. He had seen 2 patients previously in his whole career with Addison's, so I guess it was a blessing in disguise that I ended up with him. So we called him on the phone, and I told him, I said, you are an effing idiot. And I said, but thank you so much. And he said, I'm so sorry, Trace. And he said, sometimes a blind squirrel finds a nut. He said, and I'm so happy that I was able to help you. Started feeling good, got me on the steroids. I started feeling good. They got me to walk the halls around the hospital to make sure that I wasn't going to faint or pass out or have trouble with anything. But as soon as I got on the steroids, I just felt like a brand new person. I was thriving. My husband couldn't deal with it, so he actually left me and my 2 small boys and went back to university. Told me on Tuesday. He was leaving Thursday to go back to school. And I was still I was feeling a lot better, but I was still quite sick. And so my 2 little boys felt like that they had to parent me or look after me. And that was like such a burden on my heart and in my mind too, because they were only 8 and 10 years old. Yeah, so fast forward, it's now 2025. Last night my body was going into a crisis. Got some IV fluids, got some IV steroids. I'm feeling a little bit better today, but yesterday here in the area I live, it was like 40 some degrees and it was hot, and the heat near kills me. I have to have everything cold around me all the time, but I am in menopause also. And plus I put on like 40 pounds because of the steroids and not eating a healthy diet, still wanting those chips. Then my brother was on steroids for quite a few years for rheumatoid arthritis, and he had a lot of the same symptoms that I had. So we went to St. John and saw a doctor down there, and he diagnosed him with secondary Addison's disease. So him and I really talk to each other a lot because we know how each other feels. He just doesn't have to take the Florinef where I do for my sodium and potassium, I guess, or potassium. But it's still so hard to believe that emotional stress or what goes on up in your head can affect your body so much physically. And if I'm upset about something, like I'm in bed for like 3 days if I don't updose. I love to travel. Traveling is really hard on my body if I don't updose. Um, and I tried the pump, the diabetic pump or whatever for my steroids, and I thrived when I was on that. It worked so well, but I was allergic to the tape that stuck to my skin, and I developed an allergy of the steroid going into my skin. So now, even if I need my emergency injection, if I have to inject it into my leg or my arm, I get for probably 2 weeks a huge welts like that will come out about that big, and they're super itchy and they just bulge right out. If they give it to me through my IV, I seem to be okay. I don't have any issues with that. I take 25 milligrams of steroids every day. I want to try to get it down a little bit lower to see if I can get some weight off, and I don't, it's a hard life. I wouldn't wish this disease on anybody. I question God a lot, like, why do I have to have this? But then I think, well, why should anybody else have to have it? It's not fair. I feel like I was such a social person and someone that was on the go all the time and enjoyed life so much. And every time I tried to do something and my body would fail me, I would just get so frustrated and so upset with myself because I wanted to go and I wanted to do and I couldn't. My children, I had to show them how to inject me. I feel that I was a burden to them because they were so small and they thought they had to look after me. Today's been a hard day, I think, because I was on IV steroids yesterday, so I'm trying to wean down a little bit today, so it's an emotional day. I've been watching Jill's Pickle Jar podcast, and the information that she puts on there is so helpful, and I'm so thankful. I reached out to that Dr. Heather over in France to see about having that biogenic scanning done, and I'm going to see if I can try to wear that patch, like if she gets back to me. She hasn't gotten back to me yet, but I'm hoping I'll fly to France if I have to. I'm willing to do anything and everything I can to make myself feel better. If I know I have someplace I have to go now, I have to updose my steroids a couple days prior just to get my body prepared and my mental health prepared to a place that I don't get the anxiety and the stress, worrying about, oh, am I going to feel good enough to be able to do this? My brother is a transport truck driver, and about a month ago he was driving truck and he took a drink of his coffee and it was really hot in his mouth and he spit it out, and when he spit it out he blacked out and went unconscious and went across 2 lanes of highway with the transport truck hauling a trailer down through the medium and up on the other side. Luckily nobody was hurt. He wasn't hurt. When he came to, he got the truck off the road right away, but they revoked his driver's license, so he can't work. And it can really put you in a state of depression because he also was a very social person and all would go on the time and doing things and love life, and not to be able to do that stuff anymore. And I feel like my children don't ever remember me being healthy because prior to being diagnosed, I was still so sick all the time in bed that I don't think they ever remember having a healthy mom. And that breaks my heart. Anyways, yeah, I don't know what else to try or what else to do to try to make myself feel better. I ended up, my husband and I separated last year in September. So this year was really, really hard on myself. I was in the hospital 5 or 6 times. The doctor had to put me on pain meds because the pain in my body is so severe some days that I couldn't get out of bed. So now I feel like when I do have to go to emerge, I feel like they think I'm just here, a drug user that's there for drugs, because I usually will inject myself before I go to the hospital. So when they do my blood work, it'll come back somewhat okay. Last year in September, I was really sick and I drove myself to the hospital, and I was treated so poorly by the doctors. They gave me some IV fluids, and the doctor came in and she's like, so do you feel any better now? And I'm like, no, I don't. I still feel like a bag of shit. So they sent in a specialist, an internal medicine doctor, because I called my family doctor and said about the poor treatment I was getting while I was at the hospital. So he called, and a new doctor came in to see me, and they did a urine sample, and he said, Tracy, no wonder you feel so bad. Your urine is right full of pus. You have a really bad infection in your kidney or bladder. And he said that's the bad thing about steroids. They can, when you take like a high dose trying to make yourself better, it can mask a lot of underlying problems. Also, right before I was diagnosed with Addisons disease, because I was having so much pain in my back and my side, they thought it was my appendix. So they took my appendix out, and when they did, I almost died. They had and it didn't matter what they gave me for pain medication. I was just screaming with pain, and they had to keep my bed turned almost upside down with my head being down, because I couldn't even, I was passing out just laying in the bed. So they turned the bed the opposite way. And anyhow, I know I'm rambling here a lot and not probably making a whole lot of sense, but yeah, that has been my journey. I am so excited to talk to Dr. Heather, and hopefully she can help for myself and my brother. And I guess that's my story. When I see the stories on Jill's podcast, I pray for everybody for health. I pray for someone to finally do something and do some type of research that they can measure levels in our body without always having to go to emerge when you know you're not feeling good. For me, when I go into a crisis, I get a really bad headache, and it's in the back of my head, and it burns down my spine. I always suffer from migraines, but this is like a migraine times by 10, and it feels like your spinal cord and the stem of my brain is on fire. And then I start vomiting, and I cannot stop vomiting. One time I vomited for about 13 hours. Even if they just gave me a little sip of water, I would vomit it right back up again. And it scalded all my throat and all my my esophagus, so they had to give me special medication then to help heal that, because it was all from the acid in my stomach coming up, burnt everything in my, like I said, in my esophageal, in the back of my throat and my tongue. Yeah, so if anybody in there has it out there has any suggestions or any ideas about anything else I could do to make myself healthier, I would greatly appreciate your feedback. Thank you. I hope everybody has a great day. Bye.